Everybody. Welcome to the first Sexual Violence Research Initiative International Centre and What Works joint webinar on our project called Being Heard, involving children and young people on research on sexual violence using participatory methods. It's really wonderful to be able to host this webinar during the 16 days of activism. First of all, let me introduce myself and the team behind this webinar. I'm Liz Dartnell. I manage the Sexual Violence Research Initiative, a global network. We aim to promote evidence for improved practices and prevention of violence against women and girls in low and middle income countries. For those of you who don't know us, you are really welcome to contact me or my colleagues or visit our website at www.sbri.org, but we'll leave that up online at the end of this webinar. I also want to note that this webinar has been made possible by some key individuals, including my colleague Samantha Willem, for many of you who already know from What Works, Morma Maremi from the Sexual Violence Research Initiative, and of course, our esteemed presenters, Silvie, Bovarnick and Helen Beckett, who I will formally introduce a little bit later, and our funder, the Oak Foundation. Thank you very much, all of you. Just a brief overview of what we've got planned for you over the next hour and a half. First, Sam, our webinar expert and Zoom Fundi guru, will give us a quick house guide on the webinar platform. I will then provide a brief background on the project, followed by presentations from both Silvie and Helen on their part of the project. We are then going to open up for questions, and Morma, Samantha and myself and other colleagues will help ensure we gather and answer your questions. I'm going to now hand over to my good colleague Sam, who to educate us on how to use the web platform. Over to you, Sam.
Thanks, Liz. One of the reasons we use Zoom is that it's so beautifully simple. So we understand it. So as you can see, Silvia is sharing her screen. She will move us through slides as she speaks. Couple of things I'd like to ask. For those of you who haven't used Zoom before, it's the normal idea of if you keep yourself on mute and off video unless you're actually speaking. It just helps with minimizing background noise and bandwidth issues. If you look at Zoom, I think most of you have already worked this out, but if you run your mouse to the bottom of your screen right now, you'll see the facility on the far left to mute or unmute, video or no video. If you're asking a question, you're welcome to put yourself on video. It's quite nice to see people when they're talking. Try and pretend we're in the same room. And then you'll see as you scroll along your screen towards the right-hand side, there's the chat facility. So if you want to at any point send a message to everyone or to just one person, so you could send a message just to myself if you've got a technical problem, or you could send it to the whole group. We're going to use this for a few things. If you do have a technical problem and something's not working for you, sorry, I think I just cut out for a minute there. If you have a technical problem, you can send a message through chat. Myself, Liz, Morma will be monitoring the chat throughout. Similarly, when it comes to question times, you're welcome to write your questions in the chat facility. We do urge people to speak, though. It's quite nice when it comes to questions and reflections that people actually share through the spoken word. But we're also welcome to type in messages, and we will collect them and make sure that the team answer all those questions. The other facility, as you keep scrolling along, is on the bottom right, the far right. There's a facility to raise your hand. So again, at question time, discussion time, etc., if you'd like to ask a question, you just raise your hand and we'll be monitoring it. And we'll literally, it's to try and give us the feel like we're all together in one space. What else do we need to know? You might see a little red button flashing in the corner saying recording. We are recording the session so that we have it available. We will then make it available on the SBRI website, the University of Bedfordshire website, and the International Centre website afterwards. And it's quite nice to have. There'll be an audio version or an audio video version. So you're welcome to download that at any point and rewatch or share with colleagues. If anybody does not want us to record, please let me know either now or send me a chat to that effect and we'll address that. I think that's all I've got from the tech side. Any other technical problems, just send me a chat, and if you can't do that, just raise your hand. I'll be monitoring that. Okay, so that's from the technical side, it really is that easy. So let me hand back to Liz. Thank you.
Thanks, Sam. I think I'm a little bit more confident on how to work a Zoom webinar, so I really appreciate that and bringing us all up to speed on how to interact over the next hour and a half with each other. So I just want to give you a little bit of background on the project and why we are all here today. This webinar focuses on findings coming out of our Being Heard project. And just to remind everybody that this is a collaboration between the Sexual Violence Research Initiative and the International Centre researching child sexual exploitation, violence and trafficking, based at the University of Bedfordshire in the United Kingdom. It is funded by the Oak Foundation, and through this project we're trying to promote the ethical and meaningful and participatory involvement of children and young people in research on sexual violence. So why have we started or embarked on this project? As a field, we are very aware of the connections between violence against women and violence against children, and the links between witnessing violence in childhood and experiencing and being exposed to toxic childhoods and later perpetration and victimization of violence against women and girls. More and more, our research is involving children and young people, so to ensure that our interventions and programs are informed by the needs and motivations of the folk that are going to be using them, who will benefit from them most. As young people have telling us regularly, nothing about us without us. Even though we know how essential it is to involve young people and children in the studies, we're finding it's not happening as much as we thought it might be. How do we find that out? Every 2 years, the Sexual Violence Research Initiative holds a biannual major research conference. When we looked at what was being presented in our conference forums, we did not find a lot of studies and researchers using participatory methods with children and young people in their research on sexual violence. And so we wanted to know why and how could we address this gap. And so the Being Heard project was created. Just a brief overview, the Being Heard project has 2 key parts. The first part is to how to engage young people in major academic events like the Sexual Violence Research and Forum in a meaningful and ethical way. And the second part of the project is why we're here today, is a global scoping review and what has been done internationally to engage young people in research on sexual violence. The review is looking at barriers involving young people in research on sexual violence and examine some of the challenges of doing so. So that brings me to introduce you to our 2 esteemed speakers, Dr. Silvie Bovarnick and Dr. Helen Beckett, who will share with us the findings of the review and talk with us about why and how we should engage children and young people using participatory methods on research on sexual violence. So first of all, just to introduce Silvie. Silvie is a research fellow at the International Centre at the University of Bedfordshire, where much of her work focuses on youth participatory approaches to research on sexual violence. Silvie has a PhD in international relations and 20 years of experience on research in the fields of human rights, gendered violence, and child maltreatment. She is a senior research officer at the National Society for the Prevention of Cruelty to Children and has conducted studies on child trafficking and neglect. Prior to this, she has served as a research associate at the Department of Health, doing a comprehensive national research program on the health and mental health effects of violence and abuse. So we have a lot of experience from Silvie. And then Dr. Helen Beckett. Helen is a reader in child protection and children's rights and director of the International Centre. She has 20 years experience plus of undertaking and managing applied social research across academia and the voluntary and statutory sectors, with a particular specialisation in sexual violence in adolescents and ethical approaches to researching this. Dr. Beckett leads on the International Centre's training, consultancy, policy and dissemination work, ensuring that learning from the Centre's work is transferred into appropriate policy and practice forums. She's published and presented widely on child sexual exploitation and regularly consults on research, policy and practice in the field. So we're really honoured and delighted to have you both here with us today. So I'm going to hand over to you both to take us through the findings of the review and some practical examples of how the review findings can be applied. Thank you. Over to you, Silvie.
Thank you very much for the introduction, Liz. I will start by briefly outlining what we will cover in today's webinar. So the webinar is structured into 3 main parts. The first 2 will focus primarily on why we should involve children and young people in participatory research on sexual violence. and I will be exploring the challenges and the values of doing this, whilst the third part will mainly be focusing on how this may be done by sharing some approaches. And there will be 2 slots for questions and group discussions, one in the middle of the webinar and one at the end. And if at all possible, it would be great if you could hold your questions and comments until then. So I will start by providing a context to the discussion by introducing the International Center and the scoping review. And I will be exploring the rationale for youth participatory research in the field of sexual violence and clarify what we actually mean by involving children and young people in participatory research. And after that, we will have 10 minutes to hear from you and have a discussion. The second part will share some emerging findings from the scoping review, and I will focus on 3 key themes in particular: the value, skills and training, and legacy. And then I will hand over to my colleague Helen, who will be sharing some cumulative learning from participatory work that we have undertaken at the International Center. And again, after that, we will have time for some further discussion. So I would like to note up front that I will refer to both children and young people, and sometimes interchangeably in this webinar. While I recognize that child refers to any person up to the age of 18, and young people to the age range between 10 and 24, I would like to say a few words about the target group of the scoping. Although we were not always able to discern the ages of participants, the materials that we reviewed covered the age range between 6 and 35 of age. And within this very broad age range, the majority of participatory research that we found involved adolescents and young adults between the ages of 16 and 25. 2 projects also worked with youth researchers as young as 9, but the very vast majority focused on this older age range. So I would like to say a few words about the International Center, where we are based. It's at the University of Bedfordshire in the UK. We're committed to increasing understanding of and improving responses to child sexual exploitation, violence, and trafficking in local, national, and international contexts. And we do this by applying academic rigor and research excellence. We collaborate and work in partnership, and we've got a very applied approach to social research. Wherever appropriate, we thrive to involve children, young people in our work, and we do this in a meaningful and ethical way. And we also focus on the active dissemination and evidence-based engagement in theory, policy, and practice. So Liz very helpfully already said a few words about how the Being Heard project came into being. And as part of this project, we undertook a global scoping review with the aim to gather evidence relating to children and young people's engagement in research on sexual violence. And we did this by applying 4 methods. We reviewed academic and grey literature. We elicited data through a call for evidence. We also conducted a small number of key informant interviews. The total number was 9, and 3 of which were with youth researchers. We also held a pre-conference workshop at the SVRI forum in Rio earlier this fall, where we consulted with delegates. So I'd like to start by looking at a definition of children's participation. So Save the Children defined the core purpose of children's participation as empowering children as individuals and members of civil society, thus giving them the opportunity to influence their own lives. And as you all know, children have the right to participation alongside their right to protection under the United Nations Convention on the Rights of the Child. And in theory, these rights are equally important. Yet in practice, there's often a clear hierarchy of rights, and this is particularly visible in the area of sexual violence, where child protection concerns frequently override children's right to participation. So in practice, this means that children who are considered vulnerable, including those affected by sexual violence, are often excluded. They are often not included in decisions about their needs and futures, or discussions about how to help to improve responses for others. Yet it is this group of children who arguably has the most relevant experience and inside knowledge of the topic. So when children who are affected by sexual violence are sidelined from opportunities to engage in the production of knowledge, they miss out on the chance to inform our evidence base and to inform our thinking about how to respond to sexual violence. And I think this is captured quite nicely in this quote, that in the context of participation for children affected by sexual violence, the primary concern is very often about protecting them from society rather than considering the opportunities for them to participate in it. And this reflects common risk-averse tendency that shy away from engaging with this vulnerable group. And in practice, children and young people who are affected by sexual violence often invite a protective response. And this relates to questions around victimhood and agency, which are quite typically constructed in binary terms. And as such, victims, or child victims in particular, may be perceived as powerless or helpless. And the notion that they can exert agency may be quite difficult or quite contradictory for some. So we need to maybe rethink our own assumptions of how we perceive victims and the attributes that we attach to young people who have experienced sexual violence and to young people in general. And in this context, it's really important to bear in mind that while not all people may want to be involved in studies on sexual violence, it is really important to give young people choice and to widen access to those opportunities, particularly for those who have typically been marginalized. So we need to identify the barriers that silence children and young people's voices in research and address those. So let's have a look at some of the barriers and some of the reasons why there is relatively little research that has engaged children and young people in the field of sexual violence. And there are many barriers, but I will just focus on 3 today. So the first barrier is that young people are vulnerable or perceived as very vulnerable. And there are risks associated with engaging young people in research on sexual violence, some of which relate to re-victimization or re-traumatization. Young people may be in crisis, and participation may also disrupt an ongoing therapeutic or judicial process. So it's really important to be aware of these things. The topic is very sensitive. Sexual violence is highly stigmatized, as you all know, and young people may not want to be associated with this topic. And there may be real resistance or repercussions from family, friends, or at community level. But there's also something around our own discomfort as researchers that I think is really worth exploring. A participatory approach entails giving up control. And there may be some anxiety around not being able to sanitize research messages. As researchers, we work in complex structures. We often have to navigate interests of different stakeholders. There may be funding requirements. We may work within organizations where there are policy agendas or mission statements, organizational priorities. There may also be concerns around opening up to scrutiny our research methodology. We may feel that perhaps participatory methods might not be perceived as rigorous enough, and what implications that might have on publishing in peer-reviewed journals. So these are all barriers that are worth exploring. There may also be some anxiety about young people's levels of skill and knowledge, both relating to research skills and knowledge around sexual violence. And these also may relate to perceptions we may hold about young people, either consciously or subconsciously. And if you think about it, young people quite often don't get the best reputation in the press. They're often portrayed as troublesome or unruly, and we may not recognize young people's strength and capacities, and perhaps subconsciously work on a deficit-based model that may not see young people as competent. And to flag, there is still a great need to evidence the value of participatory research. And so far there has been very little in terms of evaluating outcomes, partly because participatory initiatives are rarely really rigorously evaluated, and partly due to inherent difficulties in measuring impact. At the same time, there are some very strong arguments for why we should be involving children and young people in research on sexual violence, particularly in areas that affect them, as this can enhance our data because we're getting a unique insight from key stakeholders. And this can add authenticity and credibility to our research. Young people's perspectives and lived experiences can enhance our evidence base, and this in turn can inform policy and practice development and improve service responses to sexual violence. Young people's voices can also contribute to challenging cultures of silence that often surround sexual violence. So in this way, it can address stigma, and it can be an opportunity for young people to become active agents for change. And this relates to the earlier point of participation being a tool for young people to assume agency, exert agency. It can also be an empowering experience where young people can learn new skills, they can adopt a new professional identity, and in this way, participation can contribute to the recovery process and be part of a protective response to sexual violence. And I quite like to share this quote by a young lady called Maisie, who was 18, and who was part of the Be Healthy project that focused on empowering young people who are affected by child sexual exploitation and focused on their health needs. And I don't know if you can see this because my face is blocking the quote, but Maisie said, before I saw what I had been through as a weakness, a horrible part of my life, well, it is still a horrible part, but now I can use my experiences for good. I've gone from a person who's coming here to ask for help for me to someone who's coming to help other young people. And this echoes emerging evidence that suggests that feeling part of a solution to a problem that young people themselves have experienced can have a very positive impact on young people's self-esteem, on their sense of well-being, and as such that participation can actually be a part of a therapeutic process as well. So I would like to go into a little bit more detail on what we actually mean by involving children and young people in participatory research. And in the context of the scoping, we defined it as research that has a high degree of collaboration between those who are normally solely subjects of research and those undertaking research. And in this sense, participatory research can redress power imbalances in research. And it's connected to questions around who knows best, who's considered an expert, what constitutes knowledge, and who's involved in producing it. So we very much focused on initiatives that create opportunities for children and young people to influence the research process beyond solely giving information. And that could be as being involved in informing research questions or sampling, contributing to the research design and governance, or being involved in data collection or analysis, or being part of reporting and running dissemination events. So essentially, it was about children taking on the role of a researcher to varying degrees. And so we based the scoping on this model, which draws on two models. Actually, one is by Shaw, Brady, and Davey, which was about children's participation in research. And then there was the monitoring evaluations framework developed by Lancer and O'Kane. So we basically recognize that there are different levels of children's participation in research and that these can vary. So let's maybe have a look at these categories in a little bit more detail. So to the left, we've got consultative research. And this is when adults seek children's views and perspectives to build knowledge and understanding on children's lives and experiences. And it's an adult-initiated and led process that values children and young people's perspectives and offers them opportunities to influence. In the middle, we've got collaborative research, and this is when adults work in varying degrees of partnership with children as collaborators. So projects remain adult-initiated and led, but their early development may be informed by children and young people. And the green box to the right is child or youth-led research, where adults enable children and young people to initiate their own projects and activities, and the processes are owned and led by children and young people, although adults may be invited to facilitate or support them with aspects of their work. And Roger Hart notes that the different levels of participation should be viewed as a continuum rather than as a hierarchy, because in practice, participatory activities can frequently fluctuate or overlap or encompass different levels simultaneously, even within a single research project. And similarly, different levels of participation are possible or appropriate at different times, depending on capacity, interest, circumstances of the individual, funding requirements, or resources that are available to the project. However, it is worth noting that collaborative and child-led research is undertaken more infrequently due to intensive resource requirements and more challenging power arrangements. And now you've had to listen to me for a long time, so I would like to invite you to share your own examples, as I realize we've got a lot of expertise today. We're very fortunate to have a lot of you who have been working in this field, and you probably have examples that you could share. So have you used child-led approaches or collaborative approaches? And if you would like to share from your own work, perhaps you could at the same time reflect on what you felt the challenges were of using these approaches.
So can I just remind people at the bottom of your screen, bottom right, there's a little hand that you can click that says raise hand. And then we can take feedback, discussions, reflections from people. If anybody's particularly uncomfortable with talking into their computer, you are welcome to use the chat facility. It'd be really great to hear from people what your experiences are. Okay, so Helen says she cannot see a raise hand facility. Ready, bottom right. All right. If you're having problems with the raise hand facility, then just unmute yourself and chat, I think. Can you see at the bottom of your screen, scroll along the whole of the bottom of your screen. Sometimes it's the bottom right, sometimes it's the middle of the bottom.
Samantha, I would suggest that if people have comments or questions or would like to answer some of the questions that Silvie has raised, that they just unmute themselves as you suggested. I think that would be really great. Or if they just write in the chat box and we can summarize their questions and feed them back to Silvie.
Right, and somebody else has found it. The raise hand facility moves around. It's also, Philippa says she's got it at the top of the chat box, if you've got your chat box on. So yes, just unmute yourself and let's have a conversation. Let's hear from yourselves.
Hi. Given the silence, maybe I'll jump in. This is Philippa from Save the Children.
Welcome.
So I've done quite a bit of not necessarily research, but participatory data gathering with children, though most of the time it has been more towards the consultative end of the spectrum, given, well, many of the barriers that we've discussed. But I think maybe I'll just, and there's been, varying successes, sometimes it's been highly effective. But given that we're looking a little bit more towards the collaborative, child-led end of the spectrum, I thought I might just share a brief experience of a project that I was involved in or supported a little bit in Greece, where with working with the refugees, and we coming out of needs assessments, it was emerging that information was a huge unmet need of refugees in Greece, but none of those assessments had consulted with children or understood children's perspectives in terms of the information channels they would be happy to use or what information gaps they felt they had. So I worked to help design a collaborative participatory needs assessment, using some kind of participatory tools to understand the information landscape for children. And the idea was that we would train our staff and they would then train some children to act as researchers, under the idea that it would enable us to reach children who might not be happy talking to adults, and also potentially overcome some of the language barriers. So I think I wasn't involved directly in the implementation of this, and I think I'd say at best it was partially successful. We did gather some useful information, but unfortunately, in the context of the emergency response, not enough time was devoted to managing the process, to building the capacities of those children, and to involving them throughout the process. So I think in the end, it wasn't the strongest process, but there's definitely learning that we took away from that. Okay, over.
Thank you.
Silvie, can I ask a question? It's Liz here. I have a question around some of the challenges of child-led approaches, and how was there some insight around selection, training, and support to them, particularly also when we find doing research on sexual and intimate partner violence, it can be very sort of emotionally hard for the researchers. And to what extent is that issue around vicarious trauma discussed within the literature as well?
That's a really good question. We didn't find a lot of discussions around that, to be honest. I think within the sort of child-led spectrum, I think that there were two main issues that come immediately to mind. One was that young people did not always receive the support and input that they would have needed in order to really get projects off the ground. And I think there's something around, again, a power imbalance, and of really looking at ourselves as enablers to really build capacity for young people. But in terms of vicarious trauma, I mean, perhaps Delphine would like to chip in because she was part of the scoping analysis. I don't recall that being discussed explicitly. Delphine, did you remember?
Hello, everyone. Can you hear me?
Yes, I can hear you.
Okay. Yes, so as you said, Silvie, this wasn't mentioned a lot in the literature. Some studies did emphasize that they had some referral mechanism structures in place should young researchers experience any forms of vicarious trauma or even re-traumatization. Some also had some form of support around the young researchers, so some form of mentoring, coaching, to ensure that they were to ensure their well-being through the research. But overall, I would say it is a gap in the research, and just because, well, as we know, there's very few research out there on involving young people as co-researchers, and even less on involving young people in research on sexual violence, especially young people from more marginalized groups. So yes, it's definitely a gap in the research.
So Liz, just to clarify my understanding, was the question whether youth or child-led research needed perhaps more in terms of support to mitigate the risk of vicarious trauma?
Hi, Silvie. Yeah, it was following on from what Philippa was talking about, how there was a sort of gap around the sort of support to the young researchers themselves, and just recognizing that even in the violence against women field, that we experience vicarious trauma and have gone into a quite intensive program around identifying and addressing and recognizing vicarious trauma and the need to prevent it. And I was just wondering if that's coming up in the child-led participatory methods literature. So it was just building on the earlier comment from Philippa as well.
Yeah. I would say it came up to very varying degrees, and I will talk about this a little bit later, that actually sort of considerations related to ethics and minimization of harm perhaps needs more consistency in terms of developing structures around how do we make sure that those issues are addressed properly and consistently.
Helen, and I see that you'd like to come in, and then Helen Beckett would like to come in and respond, and then we've got Helen Wicht from Nepal who's also addressed this. So maybe we could hear from the two Helens. Can I just add to that a little bit in terms of, I think in the research field, we found a number of people consciously not working with children because of the concerns around these ethical concerns on many ethical levels, and many of the ethics boards globally not actually being suitably prepared and don't understand the risks nor how to mitigate them, so they just say don't work with children. So I don't know whether you come into that later, or whether in these responses we can talk about if anybody's managed to really solve this question around how you can convince your ethics boards that you are doing this in the interests of the children. Can I hand over to Helen Beckett first, and then we'll move on to Helen Wicht.
Yes, good morning, everyone. I just thought I would come in maybe with a few practice reflections here at this stage. Silvie, I can see you on the screen, so can you just nod your head if I'm speaking slowly enough for people to understand my accent?
Yes.
Yes, okay, great. This is something that we have been thinking about a lot, although it's not written up yet. We work in all of our projects with youth advisors for every piece of research that we do, and in some projects, including one we're doing at the minute, then actively involving them as young researchers. And I think we've learned a few things around this. Philippa, I thought it was really interesting you picked up that whole challenge about time to build capacity. And when I'm speaking later, the one thing I will be saying is this is not about avoiding risk, this is about engaging and managing risk. But unfortunately, this can't be done quickly and can't be done lightly. As Liz says, we know ourselves as researchers in this field, the impact of kind of hearing this and working in this field and how that can impact upon us. And so it's something that we've been trying to think through. And I think, to be honest, is probably why we're not as far ahead in involving young people and in all of the aspects of the research that we would like to, because we need to make sure that we have thought it through properly and worked it through properly with them. Now, we have found ways around this, but for me, just picking up on the support issue, it's not simply about thinking about potential support should that happen, but actually the early conversations about the potential of that happening should we want to engage in this project, which I think is a principle generally around all of this, is, you know, that needing to have that honest, open, transparent conversation with young people about how might you feel if this happens, how might we best handle that, what support would be best for you. So again, not necessarily setting up a support structure that we think is the right thing to do, but that will differ for every child, and this is what we've been having to do. And when we involve young people in research, Some need more and some need less support, and some want it in one form and some want it in another. So for me, it's really thinking through, yes, you need your basic structure of what your support will be, but it's really working through when you're bringing a young person in as a researcher, thinking through the specific support for that individual, not only in terms of vicarious trauma, but also just in terms of you're sending them out to do something that is not their field of expertise. And so actually making sure that young people are appropriately trained and supported to go out and do this. And for us, the way we do that is when we're bringing young people into a new element of work. You know, we train, we practice, we do it together, we do it with them leading and us taking a back step. So it's very much, for me, I think it really needs to be a gradual process, which is absolutely committed to handing over power, but does it in a way that is ensuring you're not overwhelming those young people who are becoming youth researchers. And I think not only for the reason of what that means for them, but we must always keep our research participants in mind. And in the same way, I would not send out a new researcher, adult member of staff to do something without proper training and support because of the impact that might have on a research participant. We must also, from my perspective, maintain those standards so that we're not sending anyone out who may absolutely unintentionally, but kind of cause a difficult experience for a research participant, not through their fault, but because we have not properly trained and supported and developed them to do that role.
Thanks, Helen. I think those reflections are really useful. And I think one of the questions is, what in addition do you need to do for children and young people? Because in fact, most of us probably need to be doing more anyway for everybody around support. Can I hand very briefly to Helen? Please say your surname properly. I'm sure I'm not saying it very well. For us to briefly hear from Helen. And then, unless there's anything else burning, I think we'll pass back to Silvie and continue with your presentation. Helen, thank you.
Hi, my second name is Veach, Scottish, so apologies for the English grammar.
Thanks.
I've just come back from Nepal, and I just really wanted to talk about that experience of we're undertaking research on sexual violence involving young people who've been reintegrated after experiencing sexual exploitation. So we're working with a group of boys and a group of girls, and we undertook a risk assessment with them together, which is the first time I've done this. And it was just so interesting to see what risks they came up for themselves as researchers. I mean, they did a risk assessment for the participants in the focus group discussions that they'll be doing, but they also looked at the risks for themselves as researchers. And it just came up with some very different findings, one of which was the risk that for the boys, who all identified as gay, that there might be attraction between because they're researching their peers, so they're having discussions with their peers over a period of kind of 6 focus group discussions of about 4 or 5 hours. So they will get to know these young people quite well, and they may already know them. In fact, it's very likely, that was another risk that we identified, is that it's very likely that they know the young people that they're involving in the focus group discussions. So there was another issue around confidentiality. They know their names, they know their workplaces, they know some of their stories. So we had to address that as well. But it was very, very useful to make a risk assessment with the young researchers themselves. And that's really what I wanted to share.
Thank you, Helen. That's incredibly useful. I do have one more question here, Kathy Stewart. So I think let me quickly open to Kathy. Kathy, you also found the button for raising your hand. Well done. As the host, I can't see the facility. Kathy, let me hand over to you. If you can very quickly make your point and perhaps take 2 seconds to tell people where you found the hand on the screen, because it seems to be wandering around today. Kathy, over to you. Kathy, you just need to unmute yourself. There you go. Great.
Okay. Kathy? Can you hear me?
Yeah.
Yes, we can. Yes. Would you like to just briefly introduce yourself and then yes?
Can you hear me? Okay, good. All right. Kathy from Zimbabwe Community Publishing. I met some of you in Rio, so it's good to reconnect. I think some of our young nurses managed to connect as well. I'd say the whole issue of trauma researchers and so on. I think a really important, we've been researching with children and young people and publishing with them for the last 7 years. And one thing we always do is that we surround problems with hope. We use a lot of creativity. We use symbols very much, and poetry and drawing. So that although we have painful problems, young people begin to transcend that pain and to see how to start dealing with things with a lot more confidence and a lot more self-esteem. So we use a lot of poetry and symbols especially, which seems to work well because people feel normally very strong, very empowered after a research process. And then the second thing, which we've just done a book called Flourishing Spring with 580 children and young people, actually on participation and leadership. And one issue which emerged around power dynamics is that young people who are very articulate are just saying that the relationships between adults and young people are so bad, are so negative, are so destructive that it's hard for them on their own to change the nature of the way adults communicate and relate to young people. And I was wondering if the centre had any experience on working with young people to really change adult attitudes and behavior and relationships.
Thank you, Kathy. I think those were very useful reflections and questions. Kathy, could you just type in the name of your book into the chat for anybody who wanted to catch that title, who may have missed it? Thank you. I think I'm going to hand back to Silvie, who may want to reflect on those points and questions and then continue with the presentation. Thanks, Silvie.
Yeah, thank you. Thank you for this really interesting discussion. I think you raised a few points that we will be covering in the next few slides, but also perhaps that we could reflect on and discuss a little bit further at the end of the webinar when we will have another, hopefully 10 or 15 minutes or so to have another discussion. So I would like to now share some of the key issues that have emerged from the scoping review. And for the purpose of the webinar, we have grouped these under 3 headings. We've got value, skills and training, and I know we've already discussed quite a lot about this because it is a very, very important aspect of participatory research. And I will also say a few words about legacy. So I would start by introducing a range of questions, really, that are useful to think about when considering participatory approaches in this field of work. And one of the key messages that has emerged from the scoping relates to the various levels of participation that I mentioned earlier, and to the point that we should think of offering differentiated levels of involvement in various stages of the research rather than trying to enmesh children and young people in all aspects of the research. And because this is such a highly sensitive field, it is crucial that participation is enacted in a meaningful and ethical way. Otherwise, it can do more harm than good. And participatory research is also not always appropriate. So in order to weigh up the benefits against the risks, we should carefully consider some of the following questions. And the first relates to the value. Does it add value to the research? Does it enhance the research design? Does it help us to answer the research question? Are we involving the right group of people that can help us inform the research agenda and process? Is it appropriate Is it appropriate for both researchers and those being researched, taking into account individual characteristics, vulnerabilities, and the context in which the research takes place? And lastly, can participation be enacted in a meaningful and ethical way? So, I mean, this raises questions around tokenism. Are we instrumentalizing young people? Are we using them to tick a participation box, or are we using them to validate our findings? To what degree are we prepared to hand over power to children, young people? To what extent can they influence the research process and the research outcomes? And this really raises the importance, and I think some of you have mentioned this during our discussion, of being aware of the limitations, our own limitations, and the structural limitations within which we work, and to really communicate these in a very transparent way with children, young people who we involve in the research, as well as the participants who are involved in the project. I mean, there are a lot of ethical questions as well that are really paramount in addressing. So does the research adhere to ethical standards, and what does that actually mean in this context? Can the benefits of involving young people outweigh the risks? And can these risks be managed effectively? And many of the ethics questions that relate to adults equally apply to children, such as that researchers should ensure that risk and harm is minimized, and adequate protection of children, young people is ensured. And at the same time, as we mentioned earlier, the risk-averse approach is equally can have many negative implications for children, young people. And researchers really need to consider the implications of excluding children from research and silencing their voices in research. So Helen mentioned this earlier, and another of our colleagues, Camille Warrington, has previously argued that we should not avoid risk, but rather think of working with risks and seeing how we can address these risks effectively. And in this context, it's really important to do a thorough risk assessment and take time, and if possible, to involve the young people in this process. And emerging research by Claire Cody, who is also happens to be based at the International Center, suggests that young people often have a very astute sense of how and to what extent they would like to be involved in participatory initiatives, and that involving them early on in conversations around the risks that are associated with this work can enhance their risk awareness and their ability to stay safe. And as Helen mentioned, it's really about looking at those individual risks, which may be very different. It may vary quite a lot from person to person. So it's really about taking time to look at that very carefully and in a participatory way. And all of this really raises an overarching and important ethical question around the remit of safeguarding responsibilities in the research context. So putting robust safeguarding measures and referral pathways in place are paramount to ensure that young people's involvement is ethical. However, this can in practice be very challenging, and especially in contexts where child protection standards may be scanty, or in research projects that have activities that span different countries, and where safeguarding responsibilities may be delegated to project partners. So how are we monitoring how safeguarding obligations are being met, particularly given that safeguarding standards vary significantly across the globe? And I think there's a really important conversation to be had also around expectations with regard to what research is able to achieve in terms of improving outcomes for children who have been victimized, and of clarifying expectations also vis-a-vis the young people who are involved in the projects in terms of what level of help they can expect and what level of support they can expect. For instance, is it the research team's role in an event of disclosure to take to support a participant to take their case to court? Is it ethical not to? And I think this sort of ethical dilemma was it really ran like a very strong theme throughout the scoping review. And I think it's highlighted quite well in this quote I would like to share that came out of one of the key informant interviews. So this individual said, "The role of the research is to build an evidence base that may improve the situation of children affected by the issue in the long term, but there is no expectation to improve the situation of individual children, young researchers or participants as part of the research project." So I think there's really a lot in this quote, and one sort of relates to recognizing our own limitations and to be realistic about the structural limitations in which we work and articulating those. But it also raises a really important question with regard to how we apply the ethos of contributing to social justice that is at the very core of participatory research. So I'd really like to invite a discussion around this at the end of the webinar and hear your reflections on this. So the second sort of key theme, and we've already talked quite a lot about this, related to skills and training. And I think there's a recognition that in order for participation to be meaningful and ethical, there needs to be the right amount of training and right kind of training in place. And this relates both to adult and youth researchers alike. And the first theme that came out of the scoping related to knowledge and an understanding of sexual violence. So as you all know, sexual violence is a taboo subject and is highly stigmatized in most societies. And there's a need for both adults and young people to have an open discussion and to really pay attention to the normalized and gendered nature of sexual violence in the context in which they live. And the scoping found that the normalization of sexual violence and the normalization of gendered sexual violence in the context in which we live can lead sort of to a desensitization, which can mean that adult and youth researchers may not be very empathetic to experiences of participants in relation to sexual violence. And tied to this, there's also the risk that researchers may not record incidences of sexual violence, and this is especially the case in research that focuses on related issues that intersect with sexual violence, such as street-connected youth or reproductive health issues, teenage pregnancy, public health, and so on. So there's a danger that the focus on sexual violence is lost. So as part of the training, adult and youth researchers really should engage critically with belief systems that reproduce and normalize gendered and sexualized forms of violence. And it's really necessary in order to resensitize ourselves to the sexual violence that permeates so many aspects of our daily lives, including the lives of children. So the second bullet point relates to research skills. And we noted, although this is obviously not applicable to this room because I realize a lot of you have significant participatory experience and expertise, but in general we noticed that there was a lack of confidence and knowledge around participatory methods amongst researchers. And there's really a need to build expertise around how to work with children and young people in an age-appropriate way, catering to different levels of abilities and experiences, making it fun and engaging and worthwhile to young people. And this is also bearing in mind that young people may have different learning needs and training may need to reflect this. And we also need to consider that some young people may have very basic or no literacy. It's also based on a recognition that young people who have experienced sexual violence may have significant and complex needs and may need ongoing and consistent support also outside of the remit of the research project. Analysis was highlighted as a particularly challenging area for young people. And so the ability to critically examine data was connected to issues around researcher neutrality and applying abstract thinking to something that really is an inherently personal experience. And this may also relate to blurred boundaries between youth researchers and participants, as essentially they're drawn from the same constituency. There was quite a lot in terms of issues around confidentiality and data protection. I think Helen already reported that from her experience in Nepal, which was very interesting. So the scoping echoed this, that there was difficulty of generating data in shared spaces. And in research where youth researchers produce their own data by sharing personal experiences, it may actually be unethical to engage the same young people in analysis, as participants know each other well, and it might be quite easy for them to identify each other's data. And lastly, there was sort of an overarching theme that it was very important to build data protection and training around confidentiality into the preparation to facilitate the research to be ethical. And there's a need to promote a more in-depth understanding of the importance of complying with data protection. I mean, there were incidences that came up in the scoping of youth researchers naming perpetrators or victims at dissemination event, which led to a host of problems, not only for those implicated, but also at organizational political level. And again, this really raises questions in terms of the level of training that we really need to put in place in order to equip researchers, both adult and youth researchers, to do this work well. So the last bullet point relates to communication skills, and some of this may actually overlap with the research skills. So the scoping identified a training need around how to communicate in age-appropriate ways. And as you all know, there are a lot of creative and interactive methods using visual materials, audio, video that can be used in different aspects of research in order to gain informed consent or formulate research questions, or that can also be applied to data collection and analysis. So it really pointed to a need to build capacity and roll some of this out more broadly across the research community. There's also the need to provide training for youth researchers on how to speak to peers about sensitive issues. And I've mentioned earlier that sexual violence is quite often a taboo subject, so it's not openly talked about. So it's really important to facilitate feeling comfortable speaking to peers about this difficult issue. And also to promote sensitive interviewing skills. And this relates to the earlier point I made about our desensitization that is connected to the normalization of sexual violence. And sort of my last point relates to something that also was mentioned during the discussion earlier, that in order for participation to be meaningful and ethical, we need to prepare and equip youth researchers to be confident in public speaking and to be able to communicate with different stakeholders in ways that facilitate young people's voices to be heard. And I know Kathy had mentioned that quite often young people are portrayed in a negative way, or adults may interact with them not on an equal footing. So I think this is very much based on the recognition of what young people are up against. And it reflects views held in many societies that may not consider young people as competent or as entitled to speak to a professional audience. So it's really important that we enable young people to showcase their competencies, to inform debate and assume agencies. And this really should be reflected in the training that underpins participatory research also in the area of sexual violence. So this brings me to my last slide, which relates to legacy and the question of what happens to youth researchers after the research project ends. And this is a question that is often overlooked when planning a research project. Yet it is a point that was of particular concern to some of the young people involved in participatory initiatives. And the scoping highlights that young people not only need support during the research process, but they also want help to transition into independence after their involvement in a research project ends. So for me, this brought up the question whether ethical and meaningful research should not also include considerations about sustainability. So how can we expand that concept to accommodate thinking around sustainability? And considering the following questions can perhaps help us to think about this on a practical level. For instance, how can we phase out support ethically and responsibly after the project has finished? And I think that may also be vary quite significantly across young people. So I think we need to really build in time to speak to the individual young person, see what that looks like and what that feels like and what the needs are and how we can best accommodate that in the individual context. And it also really requires us to critically engage with the issue of aging out and the transition of young people who are involved in participatory work as they are moving into adulthood. And this can be a period of anxiety and uncertainty for some young people, as it also constitutes an identity shift. And some young people have told us that they have noticed a discrepancy between the cocoon participation world, where their voices are validated, and the real world, where their experiences and their skills may not have that same currency. So I think it's worth us thinking about how can we facilitate that a young person's contribution to the project is recognized and documented in a way that is useful for their future, whether that's continued training or education or their future employment or career. So how can we make sure that young people's participatory involvement in research actually has a legacy? And with that, I would like to hand over now to my colleague Helen Beckett, who will talk a little bit about some of the cumulative learning that we have from work that we have undertaken in the International Centre.
That's great. Thank you, Silvie. I was just taking a look at time there and realizing that we're 20 minutes until 10:30. So I will probably cut what I'm doing slightly short, but I just want to ask people, if you have a question already at this point that you'd like to discuss, or if you have a comment you'd like to make, could you maybe just let us know now on the chat, so that I don't want to talk and give nobody else an opportunity, which, as Silvie will tell you, I could talk all day about this. So maybe let us know now if you have a particular question, and I will maybe try to adapt what I was going to say to answer any specific questions that there are, rather than necessarily kind of run through what I had planned to do. So I'm going to just give kind of 10-20 seconds, see if anything pops up on the chat. Okay, nothing popping up yet, so I will start, but perhaps Sam, Silvie, Liz, you can keep an eye on that and just interrupt me if there are questions coming up that we can change to that.
Yeah, sure,
Great.
we'll do that. Great.
Thank you. Okay, so I am going to do, Silvie, sorry, could I get you to go back one slide? Yeah, I'm briefly just going to kind of give a few examples of what we have learned from trying to kind of involve young people in the actual process. And then I'm going to focus more in that really important point that Silvie was ending with there about actually sometimes we don't feel kind of skilled enough and we don't quite know how to translate our commitments to ethical and meaningful engagement and addressing power dynamics, how to translate those into practice. So I'm again just going to share a few tips about this. And do feel free to follow up with us afterwards. We love talking about this, so we are always happy to do so. So briefly, what you have in front of you at the minute on the screen is some examples of different projects that we have done where young people have been involved not only as research participants, but in terms of helping do the work, set the agenda, etc. And we've done that in many different ways. I have to say, I think probably where we are best and most experienced is in involving young people in helping us to disseminate what we have found. And an example that literally came out there last week or the week before was on the result of the Alexi project that we've been doing, looking at what are the key messages about young people's participation in the field of child sexual exploitation. And we had a really lovely opportunity there to work with a young designer, but also then to work with our youth panel and to come together and to say, well, our literature review about youth participation told us this. What feels important and how do we want to communicate those? And what was interesting about this was, how do we want to communicate that to professionals? Because I think very often we only think about involving young people in communicating to other young people. But actually what came out of that, and we can send a link to this afterwards, was they created 10 postcards of principles that had come out of the literature review, but articulated in a way that were the key messages they wanted professionals to hear, which is, if you're working with young people affected by sexual exploitation, this is how you need to treat them. This is what is important to young people. And that's been a really lovely example of being able to bring together directly young people's perspectives and also what has come out of a literature review, and sharing the findings of a literature review with them to discuss how do we make that into something meaningful. The other one you can see on the middle on the right hand side is, what role does a woman play in a gang? And this was actually a challenging but really interesting project for us, where we were doing research that I was leading on young people's experiences of gang-associated sexual violence. And whilst we tried to be very participatory in how we let young people engage in that and setting the agenda within interviews, etc., we were commissioned to do that work by a funder, and we had to deliver certain things that the funder wanted. And we had to ask, not the specific questions, but we had to address the themes the funders wanted. Now, what we felt was really important was finding another opportunity for young people to say, well, actually, these are the themes that are important to us. And so we were really lucky to get some additional funding, and our colleague Camille Warrington led on this alongside the research I led on, where we said to young people, we've got money. We want you to tell us what you think is important to you and your community about these issues. And over a kind of series of workshops and coming together, there were 4 different films in 4 different areas that the young people decided what they wanted to say. They scripted the film, etc., etc. Now the reason I say it was challenging was because there was a message, and it's actually in that one if you watch it, where they talk about a young woman called a link. So someone who sleeps with gang members. And there is a line in the video that says, we're not all like them. And is quite, the young people had no issue with it, but I read it, and I had been interviewing lots of young people who were links and who felt very demonized and isolated and judged because of that experience. And I had a real challenge because that line just really stuck for me. And I struggled with that message. And so for us, this was a really steep learning curve about how do we deal with this? And actually, how do we deal with the fact that I, as a researcher, am not comfortable with something we're going to be putting out as a product? And so, as I say, it was a really interesting learning experience. And what we just had to do, which I would say is my advice for any of this, is just be honest and have a conversation. We had to go, we spoke with the young people, we explained why I had a concern, they explained why they didn't see it as an issue, we talked it all through, we talked about how we could manage it, and in the end, which anyone who works with me will tell you, I backed down, so that's a slight struggle for me, but we went with it in the video. And so I use this to illustrate the fact that if we truly want to be participatory, that can sometimes put us in really uncomfortable and challenging situations. And yes, you know, I explained my concerns, I heard theirs, but I had to accept that the message young people wanted to put out about this piece of work was not the same message that I, as a researcher, wanted to put out and felt was important. And so we had to find a way through that together, and so they could hear my concerns and address that, so it didn't come across in a way that other young people would find it negatively. But ultimately, I had to accept that what was important to me was not what was important to young people, and it wasn't for me to control their message. So it was a really kind of interesting learning curve for us around how you do this stuff. And Silvie, can we just go to the next slide? I'm going to now think a little bit about kind of, so what does that look like when you're actually engaging young people in research? The giving over control, the it not being all about me and what I want and what I need, and how do we change this? And I put up this quote from the Economic, Social and Research Council from their ethics statement, just to illustrate the fact that I love that they don't just talk about minimizing risk and harm. I think, and Silvie also talked about this, I think when we think about this field, we think about, oh, harm, risk, danger, how do we manage that? But actually, we do need to think about that, but what we also need to think is, how can we maximize benefit for people who we involve in our research? Actually, how can we maximize benefit by even giving them the opportunity to be involved in our research? Recognizing, as Silvie has said, came out of the literature review, and as was actually shared there by some of our contributors, that actually taking part in research, whether as a participant or in kind of more involved in the process, can be a massively empowering and restorative experience for young people if done correctly. So I'm just going to share briefly, to keep us to time, 5 different things. If we could just go to the next slide, please, Silvie. These are 5 things that our young researchers, our Young Researchers Advisory Panel, I always call them the wrong name, came up with when we were planning our presentation for SVRI in September. And actually one of our youth panel put this all together with me, and they presented with us on this. So I'm going to stick to that because this is what was most important to them. And we identified 5 key things around the concept of participant welfare. But as visually seen in this diagram, participant welfare is at the heart of what we do. We cannot engage in anything without thinking about participant welfare, not only in terms of avoiding risk, but also in terms of maximizing the positive impact on their welfare of the opportunity to take part. And for me, we think about this at 2 levels. At the most basic and first level is it in their best interest? Is it in their is it for their welfare to actually take part in the research? And sometimes it may not be, and many times it may be, but actually we don't give them the opportunity because it requires extra effort for us. And I don't say that in a judging way. I say that in the way that I know we are all absolutely very busy, and what funders will allow us to do is very limited. And so, coming back to Silvie's point, it is not about doing it all in every project to every degree. For me, it is about, in the limitations of our project, how can we best do this? How can we not be tokenistic? And maybe it is that we involve less young people, but we do it better than trying to involve more young people. Or we involve them in less of the project and do it well, rather than trying to involve them in a tokenistic way through lots of it. So it's thinking about, is it in their welfare to take part, and what does that look like? But secondly then, how do we look after their welfare when they are taking part with us? And this is kind of some of the examples we're just now going to go through. So the first one of open mind, our young people felt particularly strongly about, and the young man who co-presents with me on this feels very, very strongly about this. I think particularly as a young man who has experienced sexual violence and who has experienced a lot of assumptions about how he should act or feel, which actually do not reflect the reality of his life. And he, openly shared about this. And I'm just going to kind of use a quote of something he wrote for us from sharing. For him, it is about avoiding a victim blueprint. So not going in with a sense of what a victim or someone who has experienced sexual violence should look like, should act like, should feel. and just avoiding those assumptions. And as he says in his own words, you need to respect how the young person feels and how they describe things. Let them do it in their own language and don't judge what they say. Don't ask questions or say anything that will invalidate their perspective. And for him, this was really important because he's had experiences of both, of experiences of starting to share about how he felt about something and feeling, whether through a verbal or a non-verbal response, that that was not what the researcher was wanting, that it wasn't fitting their research agenda or their hypothesis of what they were expecting to see. But he's also had experiences, really positive experiences, of feeling that actually the researcher is genuinely interested and open to hearing what he has to tell them. And for me, it is absolutely about that. We do not know what a young person feels. Silvie has already talked about the fact it is different for every child. We cannot go in with a research hypothesis, particularly in this field, of thinking we know what our participants are going to tell us. And sometimes we can fall into that, particularly on a project if we've done lots of interviews and lots of the same things start coming up. But we need to never close down the opportunity that the next person might have such a different experience. And if we only focus in on what everyone has already told us and ask them about it all over again, we could be missing what is absolutely critical for them, what is critical for us in terms of understanding their experience of sexual violence and how to better respond to that. So what is absolutely critical for me, whether it's in an interview or a focus group or any other type of engagement, is keeping it open. It is very much for me about letting the young person set the agenda of what happens when we meet. So I generally in this take a very unstructured approach to interviewing. I will have a topic guide. I will know what the funder wants me to do, but the order in which we deal with that, whether we even cover all of it in every interview, all of that will be led by the young person. I'm just seeing a message from Liz about how much more time do I need. I'm going to take a couple more minutes and then we will kind of go to other questions. So it's keeping that. And what does that mean practically? Practically for me, it is very much responding to where they go. So very often in an interview, we will go off at what might appear a tangent, but it is a tangent the young person wants me to go on. And actually sometimes that's where we learn the things we never thought about. And sometimes actually the tangent is not necessarily where we want to go or relevant to what the data we're wanting to gather, but it can be part of, and I'm kind of going around my circles as I talk about this, it can be part of giving the young person back control. So the power balance in the interview. And if a young person has talked about something and it has got kind of feeling in some way distressing or potentially too difficult for them, I very often find that they will go off into something entirely different as a self-protective mechanism and as a time to recap and regroup. And you have to go there with them. It's not about bringing them back to what you want before they're ready to come back to it. And always ending for me with, is there anything that you think it's important for me to know that I haven't thought about to ask you today? Because I'm not the expert in this. You know much more than I do. Perhaps there's something that actually is really important for you that I haven't thought to ask, and it's really important that I get to hear that from you. So always handing back that control. The engaging with risk I'm not really going to do because I think Silvie has talked about that a lot. But again, we would do not just a risk assessment, but a risk and needs assessment before we engage children and young people in research. And that is not about saying, oh, there's a risk, therefore we're not involving them. It's very much about saying, okay, are there any particular risks involving this young person in research? And we do this anonymously with a worker first, so we're not given any details of someone until we know that it's safe to approach them. But are there particular risks? Okay, what can we do about that? So I think of some interviews where we've been able to kind of identify, well, actually, do you know what? Half of the stuff you'd like to look at is really safe to talk to them about. The other half might just be too potentially triggering. So I don't bring it up, but sometimes they will choose in and of themselves. But it's about identifying the risks, it's identifying the needs, and it is about accepting that as researchers, if we want to be participatory, if we want to be adhere to equality standards and good ethical standards, we have a responsibility to try to offset those risks and needs as much as we can, not simply to go, oh, there's language difficulties there, I'm not going to be able to do that. So it's thinking about how we do it. Just briefly again on the power imbalance, of course there is inherently a power imbalance in any engagement an adult and a child will have between a researcher and any participant. I still laugh about an interview I did ages ago with someone from the police who are very hierarchical, and no matter how many times I told them to call me Helen, they shifted from Dr. Beckett to Dr. Helen, because there is this, oh, you're the academic, and you know, there is a power dynamic. Now that's exaggerated when we're working with a child or a young person. So it's thinking about actively what can I do to offset that power imbalance. Can they choose where we meet, when we meet, if they want someone with them to make it feel easier? Practical things like the choice of recording. I say this to all of the people in our university when things come to ethics. It's not helpful to have in a consent sheet, do you want to be recorded? Tick yes if you do, or no. Because actually that has an assumption that they will record, and it is more difficult for a child to say no. What you should be doing is in an unbiased way saying, how would you like me to record what we talk about today? Would it be recording? Would it be by writing? Would it be that we'll draw what we're doing, etc., etc.? And making sure even in an ethics sheet that you're ticking about how you consent to be recorded is entirely separate to ticking to take part in the research. So there's a lot of practical things we can do. And in terms of recording, if it is audio recording, we show them how to work it. We set it over beside them. They can hit start, they can hit stop, they can hit pause. We agree other signals around that. And then just thinking about how you actually present yourself. So it's not just, we always think about, oh, well, don't dress in a suit and this, that, and the other. It's not just that. It's actually, how are you sitting in the room? Where are you sitting in the room? You know, let them go in first and choose their seat. Don't be sitting where you've already chosen where you're comfortable in the room. Let them come in. And I think of one interview I did recently where I did it lying on the floor because the young person wanted to keep their notes on a flip chart so they could see what we were recording. And actually we wrote those and drew those together on a flip chart, and we both just lay on the floor and did the interview, writing and drawing on a flip chart. So just kind of thinking about those practical things.
Yeah, Helen, I just wanted to say that we're really loving this discussion, but I do worry that we have run out of time and we really haven't had any time for questions.
Yeah, I will stop
so
there.
I just wonder how long you might be left, because I think that people would love to engage with us.
I will make one final point, which is just about the safe sharing, and just saying that the approach we generally take on all of this is that we work on the assumption that we approach this topic through a third person lens, so that the young person has the choice, if they then feel comfortable, to share about their own experience, but it is never our assumption that they will. So we talk generally about the topic and what young people experience, or a character or a vignette, and that really just is then giving control to the young person about being able to talk about it in a slightly removed way, or if they feel comfortable enough, then starting to share about their personal experience. I could talk all day, but I will leave it there so we still have time for discussion.
Thank you so much, Helen. That was such a wonderfully in-depth discussion and conversation. I think what you've really highlighted for us, that we really need to keep young people at the centre of everything that we do, and that if we really want to be participatory, it's not always going to be comfortable for us, and that we need to have those honest and open discussions. I really would like to open the discussion up to the floor and just leave some space and time for 1 or 2 or 3 questions, and then we might have to draw this really wonderful webinar to a close. So over to people. If you have questions, please write it in the chat, or just unmute yourself and ask Helen and Silvie some questions.
You know, it's Samantha Willen here. I just wanted to briefly reflect on the point around, Helen, on your diagram, I think it was open-mindedness.
Yeah.
And the importance of our young researchers and adults not judging. And I think that's incredibly challenging, because I think often we're talking to the person's personal politics.
Mm-hmm.
It's very hard to tell somebody not to judge.
Yeah.
So in fact, in many ways, it speaks to who do we recruit to work on the project. and look at people's personal politics when we're recruiting, because yes, we can do training and we can talk about this and we can do some personal consciousness raising, but often in the absence of that personal politics aligning with what we're trying to do, it's very hard to not judge. It's just an observation, really.
Yeah, and just to add to that, we can train people. You can't obviously influence anybody's thoughts, but you can train how that comes out. But even no matter how experienced a researcher we are, we always practice every new project. So any new interview schedule, any new focus group schedule, we actually practice together with people pretending to be a young person and responding with challenging situations, which again gives us that opportunity to identify what we might react to problematic and do it in the environment with your colleagues rather than that first engagement being with the child.
Thank you, Samantha, for the question, and Helen for the response. There was a question also from Kathy earlier around experiences with working with adults and young people and trying to strengthen and improve those toxic relationships that she's starting to find in her work. If anybody has some resources or materials that they might be able to share or experiences, Helen, Silvie, do you have something you might be able to share through your work or your review?
Yes, we do. So just in March, we finished a piece of work where actually we brought police officers and young people together to look at this very issue because of the problematic relationships and experiences that were coming out in our research. And we have some resources and reflections we can share about that. We can send the links. In terms of the practical reflection, what I would just share is when we think about bringing adults and young people together, we naturally think about preparing young people for that engagement. At least as critical was preparing the professionals to come and engage properly with young people and to be able to hear criticism without leaping in and being defensive. And we've had experiences where that work wasn't properly done, and young people actually then it can be a worse experience because they just feel unheard and this, you know, why did you do this if it didn't make a difference? So it would just be to flag that practically the pre-work with the professionals is at least as important as the pre-work with the young people.
Thanks, Helen. That's some really great advice. Is there any other questions or thoughts that people would like to ask?
I see there's a question from Ritu. Ritu, do you want to just unmute yourself?
Yes, sure. Hi, everyone. This is Ritu Jain. I'm here in New Delhi, India. I utilize, and our organization utilizes creative movement therapy and other arts-based methods to work with various populations. I'm currently looking at arts-based methods as a way of gender-based sexual violence prevention, working with youth, and potentially a participatory research methodology. And was wondering if any of you have come across research using arts-based methods, and you know, whether it was participatory research or not, and if anyone has any thoughts about that. I mean, I'm reading stuff on it, but you know, I'm still trying to locate some models that may have been used. So I'm just wondering if anyone has seen anything like that.
Okay. I will quickly come in here to say we have recently released a piece of work, Making Noise, that we can, if you take a look at, we can share more information about the methodology there. But also maybe to ask if Claire Cody is still on the line, for Claire to come in, because she is looking at similar things with her doctorate. No. Perhaps we've lost Claire. If you link up with us, we will link you up with Claire Cody. She works with us, but she's doing her doctorate looking at the use of creative methodologies with young people in this field.
Okay,
Claire
excellent.
is still on the line, so maybe she is just trying to unmute. But that being said, I just wonder if we could share those resources and materials that you've spoken about, Helen. That would be great. We could do that either via email to people. If you want to, Rita, if you want to share us your email, we can send you those materials. But also, Silvie, if you wouldn't mind just going to the last slide, because I'm going to start drawing this conversation to an end. I just want to say that really both Silvie and Helen, you've given us a really fantastic overview of the barriers, the risks, the benefits, and the common ethical issues that we experience when doing this type of research. It's been a really wonderful discussion. I'd really like to warmly thank and appreciate all of you, participants, partners, presenters, for being with us today. And I'm sure that the review that Silvie and Helen are working on will be strengthened as a result. And please do share some of the experiences that you shared with us so that we can include them. For example, Helen Beach's work from Nepal. I think that sounds really, really interesting. And just to let you know that the findings of the review will be shared both via our website. The websites are listed up there. And if you want to contact us, please email us, and Silvie and Helen's emails are on the previous slide. Finally, as I draw to a close, I would really like to once again thank our partners on this webinar, the International Centre, What Works, our funder, the Oak Foundation, and the South African Medical Research Council, and of course all the participants. We really, really look forward to hosting you all again in another similar event, and I really appreciate you for staying a little bit over time. So thank you all, and if you have any email questions and want to email us, there's Silvie, Helen's and Camille's email addresses, and our email address is on the next slide. So Helen, Silvie, any last words from your side? No, thank you so much all, and go well and enjoy your Friday. Thank you.
Thank you,
Bye
everyone.
all. Thank you. Bye.
Thanks.